We've spoken before when this decision loomed, but not when it was in our faces as potentially imminent. And I wonder your thoughts today as someone still on the front lines trying to help women in crisis.
Yeah, I think we've seen this moment coming for decades now, but certainly the closer reality of it is shocking. It is devastating to see the words that were written by Supreme Court Justice of the United States. And what I've seen over the last 8 months here in Texas is we've been living in a post-Roe world where Roe essentially has no meaning. And what we've seen is that people continue to need access to abortion care, that banning abortion doesn't make it go away. And what's happened is people have been traumatized by the process of having to travel hundreds, if not thousands of miles to another state to get the care that they could get safely here within their own communities. And it's a really devastating moment. I think the writing is on the wall. But for folks like me in Texas, we're not waiting for the Supreme Court. We're not waiting for our elected officials to do what we know our patients need. We're moving into action and taking care of our people.
I want to read some reporting about what is likely to happen, not just to physicians, but the men and women training to do what you do, to be physicians. This is from Axios. Abortion training is in peril if Supreme Court overturns Roe versus Wade. Almost half of OBGYN medical students will not receive any abortion training if the U.S. Supreme Court overturns Roe versus Wade this summer, according to a new study from the University of California, SF. Researchers found that 44.8% of the 286 accredited obstetrics and gynecology residency programs are in states that are certain or likely to ban abortions in the absence of Roe. The researchers suggest that clinical educators arrange out-of-state travel rotations and patient-centered early pregnancy loss training. A press release for the study says it's literally a purge, not just of reproductive health procedures, but of anyone trained in doing them. It's stunning.
Absolutely. You know, I was looking for a medical school 15 years ago, and my schooling was mostly done here in Texas. And even from 15 years ago, not much has changed. Training has been difficult, especially for family medicine doctors and OBGYNs. And I think as we move into this new landscape of potentially extremely limited access to abortion, how do we train the next generation of abortion providers if we don't even have access to abortion in that state? So this will only get worse with time, unfortunately.
And what is sort of the conversation among doctors and patients when you can't provide the care a woman needs? I mean, what is available to those women?
Yeah, I mean, I will say just from a personal perspective, that conversation as a physician is extremely difficult, especially when you're trained to provide that care, when perhaps months ago you were providing that care for people in the health center where you're working. And to suddenly say we're not able to do that feels immoral and unethical, especially when you're sitting in front of another human being who's asking you for help that you could provide. I think what we've seen instead is that we've had to help a lot of people access care in other states. That often means traveling hundreds, if not thousands of miles. A lot of people are driving, sometimes with their kids that they already have in the car with them. That means overnight stays in hotels in other states, having to think about the cost of food, time off of work, for some people, childcare for the kids that they have at home. It is very costly. It is very traumatizing. It is very difficult. And the last thing I'll mention is that, unfortunately, many of the people I've seen have said traveling out of state is just not an option for me, whether they're undocumented, whether they have an abusive partner that they are tethered to and cannot leave, whether they can just not surmount the logistical requirement of getting to another state and getting to that clinic or the cost or whatever it may be. And many people have been forced to carry their pregnancies to term when they know that they can't carry those pregnancies in a safe way, when they know that they don't have the resources to parent a child. And it's really curious, you know, to think about what the opposition thinks is going to happen to all of these people, especially when we know what's going to happen, that many people will stay in poverty. Many people will face morbid outcomes. Many people will also die because they don't have access to abortion. And it's unfortunate that we're moving into a time when that reality is going to be upon all of us.